Welcome to Adapt NCLEX, and thank you for deciding to watch this video. This is Adapt NCLEX series on commonly tested topics that you need to know before you can take your exams. It's a test-taking strategy, it's high-yield content that you need to pay attention to. So buckle up, see how we attack content with test-taking strategy, and then see how I approach the questions. Of course, prioritization is number one, always. Who should the nurse see first? First person. The nurse is aware of this client. Who need to be seen? Prioritization. Draw a line and divide them into two, right? Then you look at it. If there's the age, if you take a test and somebody said, look at the age in terms of prioritization, please don't do that. 6 years old is not better than 4-year-old. 4-year-old is not better than 10 or 7. So age is not a factor. What is the problem? Look at the condition and see what is happening to them. If you have glomerulonephritis and you have T-colored urine, that is unexpected. This is you are being shot, right? If you have pyloric stenosis, I know this is dehydration, but it's an expected finding, projectile vomiting. If you have cystic fibrosis, thick fluid sputum is what? Expected finding. You make a bunch of secretion. That is the definition of cystic fibrosis in terms of the lung function. If you have acute asthma exacerbation, I should be seeing you wheezing. You should not be resting, right? You should not be doing that. If you're not wheezing, this is a bad problem, bad problem, bad problem. We need to see that guy. Number 4 is our boy. Number 2, and this is caring for 4 clients, 4 patients who need immediate intervention after the procedure. So, you have to look at the condition and see what is happening. They are in a supine position after the procedure. What is the problem? The kidney is on your back, okay? It's a small bean-shaped organ on your back, right? And when we do the procedure, okay, when we do the procedure, we put you on your face. After that, we need to hold pressure here. The kidney is highly vascularized. There's a lot of blood vessels going there. Therefore, in order to prevent bleeding, we put you supine to put pressure on the kidney. The liver is on your right side. When you are doing the procedure, you on your back. But after the procedure, I need you to hold pressure. You lay on your right side. This is not good. You're going to be bleeding. If I do lumbar puncture, you're on your left side. After procedure, I need you to hold pressure here. Therefore, supine is good. Paracentesis, you can be in a supine position or a little bit upright or lean forward. But after the procedure, most of the time, because of hypotension and the post-paracentesis syndrome, we want you to be supine for a few hours, and then you can get up. Therefore, there's nothing wrong with it. Who is in trouble? 2, we got to see you. You need to be on your right side. Next question. And next, provide care for a client with EKG strips. How do you answer questions? Start from the back. Which condition the nurse should, suspect could be causing the finding? What finding? Thus, what did they say? And let's provide care for a client with this EKG strip. Read it carefully. I see interval normal, right? So I know this is sinus. I see my rate 1, 2, 3, so almost like 100, right? So that's my heart rate. It's too fast. Is there any P wave? See a bunch of P wave, right? And I see that the T wave is close to P wave. They all kissing each other. Therefore, this is sinus tachycardia. When you have sinus tachycardia, go to the bars rate. Underlying cause is the problem. You don't treat it. Which of these will be causing this? Hypothyroid lead to bradycardia. Hypovolemic shock will lead to tachycardia. Increase ICP, think about it. When somebody ICP is going up, we call it Cushing phenomenon. What is happening? You have hypertension and bradycardia. Therefore, this leads to bradycardia. Neurogenic shock, you lost all your sympathetic tone, right? You cannot speed up your heart rate go down. If you have severe hypothermia, what happened? Your heart rate also go down. You go to bradycardia, you go in shock. If you have Hypoglycemia, most of the time, androgenic effect. So your heart rate goes up. So which condition is causing this problem? It's no hypothyroid. It's no increase in ICP. It's no, neurogenic shock. It's no hypothermia. It's hyperglycemia and then hypoglycemia. It's hypoglycemia and hypovolemic shock. This is a hard question. I need you to think really hard about it. You can see you need an EKG to interpret it, test taking strategy. And then provide care for a client with newly diagnosed Crohn's disease, prescribe first dose of what? Infliximab. Forget about it. Start from the back. What action, keyword, should the nurse take first? You see, when you read the first portion of the question, it never tell you what you need to do. You just read it. Don't waste that time. Go back. What action should the nurse take first before administering? Then what did he say? Let's provide care for a client newly diagnosed Crohn's disease is prescribed what? Infliximab. Don't worry about the Crohn's. It's about this medication. I see a map. I know it's immunomodulator, right? It's immunomodulator. Problem, infection. Whenever you got to start this medication, the problem, infection. But what is the biggest infection? It's making you immunocompromised. And in making immunocompromised, what we look is if your PPD is positive, you're going to get active TB because that's number one they do. Obtaining blood culture is not going to help you. Place a PPD test first. Make sure this patient does not have PPD, and then you can start the medication. Urine analysis in CBC is not helping you. So place a PPD test. And number five, and let's provide care for a client what with essential hypertension scheduled for kidney disease. Once again, from the back, which of the following actions are appropriate? That means, oh, this is appropriate. Next, see a patient who has hypertension scheduled for kidney biopsy. I told you the kidney is at your back, okay? And so when we're doing biopsy, we go here. You lay on your face and we go to your back. The problem is the kidney is vascularized. Therefore, we got to make sure your blood pressure is normal. Otherwise, you're going to bleed. So before we do the procedure, we got to check that your bleeding lab work is fine. So check PT, PTT, INR. You're not giving contrast for this procedure. You don't need contrast. Okay, apply cold pack over the ecchymosis post-procedure. Flank, so if they have flank ecchymosis, you should not be applying cold pack. This is what? Great talent sign. Great talent sign. This is bleeding. If you have umbilical ecchymosis, they have Kalian sign. That is wrong. Okay, so you should be careful. Those are all bleeding signs. Okay, bleeding signs that you should pay attention to. Apply cold as over the flank ecchymosis post procedure. Like I said, great tenant sign. You should not do that. You should call the doctor. So, which of the actions is appropriate is not appropriate. Place the client in the prone position after the procedure. Kidney is on your back. You should not put them on the prone. You do prone when you're doing procedure. After procedure, on their back. So this is not appropriate. Notify healthcare provider with the map of what? 7-day post-procedure. Map of 7-day is normal. Therefore, you don't need to notify them. Which actions are appropriate? Test taking strategy to test you. NCLEX would do that. 1 is wrong, 2, 3 is wrong, 4 is wrong, and 5 is wrong. The only answer is 2. There's only one answer. Test taking strategy, right? It's all content. And let's provide care for a client with diastolic heart failure. Which finding the nurse should expect on assessment? This is one of the questions that is all full of content. If this is your heart, right, and it's receiving blood, okay, I'll clean it. If this is your heart, okay, it has 4 chambers. The right atrium, left ventricle. This is left atrium. This is right atrium, right ventricle. The ventricle receive blood, okay, and it's ship it to the system outside the heart to the rest of the body, okay. There's two types of heart failure. There's the diastolic heart failure and systolic heart failure. It's a little bit different from regular heart failure, but it's the same thing. The problem is people who have diastolic heart failure, the ventricle, the ventricle is very, very stiff. So this is a stiff ventricle. So filling is affected. The filling into the from the left atrium to the ventricle is affected. So you have less blood going to the left ventricle. But in the end, the ventricle pumping whatever is in the ventricle had, because it's very stiff, it can pump the blood out. So ejection fraction is normal, except it's not receiving a lot of blood. It's called non-compliant. Non-compliant heart failure. So most of the blood is sitting in the right, in the left atrium. And so patient will have symptoms related to the lung. Okay, it's like similar to a left heart failure, basically. So most of the symptoms will be going to the lung. The problem is you have to know you're going to have dyspnea. The S4, S3 is the problem, right? S1, S2, you're going to see it easily because they're going to have normal S1, S2. Fatigue is due to the less blood being pumped out. But you got to distinguish between S4 and S3. S4 is mostly diastolic, right? Because the heart is very stiff. S3 is consistent with the systolic heart failure. So you're not going to see one, three, but you see one, two, four, and five. Classic. S3, you will see it if you have diastolic heart failure. Diastolic heart failure means your heart is very compliant. The ventricle is compliant. So it can hold a lot of blood in the left ventricle. And so you don't have lung symptoms associated with it. And the blood, you just basically dumping to the left ventricle and you hear S3, which come after S2. Okay. And so that's the right answer. So the right answer is one, two, four, and five. A little bit hard question. And let's provide care for a client with leukemia, 6 hours post-induction chemotherapy. Which of the following is concerning for tumor lysis syndrome? This is a content. You just have to know how to deal with it. This is the cell. You got to go back. Your cell, inside, you have a bunch of potassium. You have a bunch of phosphorus. You have a bunch of DNA, right? Outside, you have a bunch of calcium. You have a bunch of chloride floating around, right? When you get chemotherapy, right? When we give you chemotherapy coming to fight you, this is chemo. What happens? The cells open up, and therefore you have more potassium outside. Phosphorus is get released, and then DNA also get released. The phosphorus is going to chew your calcium, so calcium go down. And you have a phosphorus high, you have potassium high, you have DNA high, right? All this thing is going to affect your kidney. So your kidney, your creatinine is going to go up, but your GFR is going to go down. So what do you expect? Hyperkalemia, excellent. Hypercalcemia, no. Hyperuricemia is due to DNA, right? Hypophosphatemia, no. You're going to get a lot of phosphorus and your GFR is going to decrease. So 5, 3, and 1 are your answer. 1, 3, and 5. 2 is wrong and 4 is wrong. That's what you should expect. And let's provide teaching, district teaching to a client with schizophrenia prescribed Clozapine, which the following statement by the client indicate ineffective teaching. Go back again and read it. Ineffective teaching. That means you got to question something is wrong here. You got to question it. And so patient has what? Clozapine. He has schizophrenia. Which of these you should worry about or indicate ineffective teaching? What is the problem? Clozapine is a second generation antipsychotic. What did they do? Weight gain, normal, right? hyperlipidemia, lipid goes up, right? Your glucose go up. This is common for every second generation antipsychotic. And then for clozapine, especially because it's agranulocytosis, right? So weight gain is a problem. I will need frequent lab draw because of agranulocytosis. I will renew my gym prescription so that you will not lose weight, so that you will lose weight, right? Because of the weight gain. I will avoid food high in thiamine. This is not MOI. Therefore, this need further teaching. It's an ineffective teaching. I'll report inner feeling of restlessness. This is extrapyramidal side effect, especially this is akathisia, inner feeling of restlessness. Therefore, reporting it is good. I'll report any UR symptoms immediately. That is also good. Agranulocytosis. Therefore, which one will indicate ineffective teaching? Number three is not monoamine oxidase inhibitor. So we don't need thiamine. Three is wrong. You see, that is the content I was trying to show you. That. And then provide teaching, discharge teaching to a client prescribe warfarin for DVT, which statement by the client indicate need for further teaching. Once again, I changed the language, but it's the same strategy, further teaching. They saying something bad. What is the problem? As DVT prescribe what? Warfarin, Coumadin. What do you expect? The key thing about warfarin, okay, it block vitamin K dependent factor, right? But because of that, it confused whether you need to increase your vitamin K or decrease it. I say maintain the same. Don't change anything. Don't increase. Don't decrease. Don't stop it. Eat whatever you eat, but don't go up on it or don't decrease it. I will need a frequent lab draw, yeah, for your INR and PT. I will increase my intake of fresh vegetables. The word is increase. I will avoid vitamin K rich diet. This is saying the same thing, 2 and 3. You should not avoid it. Keep on eating it. I will need a new prescription when pregnant because it's teratogenic. So this is good. I will use endomethacin for my knee pain. This is an NSAID. You cannot do that. So what need further teaching? 2, 3, and 5. Last question. And then ascertain the stratification program about schizophrenia. When caring for a client with schizophrenia, which finding the nurse should recognize as positive symptoms? Once again, back from the reading from the back. Positive symptoms, schizophrenia. Keyword, what's positive symptoms is what is diagnosis schizophrenia. Another way to say if you're positive, then you cannot be negative. If you're negative, you mean you have depressive symptoms. So things that is going down. Disorganized thought, that's not going down. That is positive thought. Hallucination is not going down. That's positive symptom. Delusion is going up. Flagged affect is going down. Lack of energy sound like it's going down. Disheveled appearance, it look like it's going down. Therefore, which one are positive symptoms? 1, 2, 3. Take care of yourself. Thank you for watching. I hope you learned something. This is Adapt NCLEX. If you're hearing my voice for the first time, subscribe and get more content like that. You can join our membership and enjoy this content. Or you can join our live course that comes out in July, 3rd of July, the third week of July. Or we have on-demand course that you can join. Is high yield facts. You will never get this from anywhere. And you'll be surprised amount of content. And you feel confident. The whole idea about that NCLEX is making you sharp, making you confident when you're going to take a test. The website is www.adaptnclassreview.com and you find on-demand course. Take care of yourself and come back again for more content like that. Take care. Bye.